our official webinar. What's your opinion?
Sure.
Ma'am, could
Yes.
just yeah.
Okay, it's just to start or what?
So, we are about to start our webinar officially. Um, Hello everyone. I hope you are all doing great. It's an absolute pleasure to welcome you all on this Insight webinar. My name is Ubadur Nawaz. I'm a third year medical student of in the International School of Medicine, International University of Kyrgyzstan. I'm the coordinator of the publications team of the Student Council of ISMI UK. Today, we are really honored to invite Dr. Amir Molik, who is journey to the dedication and the power of the strengthening plan of the pursuit of the medical career. He completed his USMLE all three paths, step one, step two, step three. And in on the Monday, he just got his match, and right now he's a resident in the US. And we are really pleased and we are really joy to welcome him on this webinar. Let me formally introduce Mr. Amir Molik. He has the YouTube channel which name as the USMLE Mastery Lectures, where he has approximately 30,000 subscribers, and he has separately crash courses of the USMLE, where he taught the students how to clear the all three paths. And he's the senior clinical research coordinator in the New York University Langone Health. Moreover, he's a licensed urgent care provider in Missouri at the in the project of IMG run by the Dr. Sebastian, and he's the director of the student success at American University School of the Medicine, Aruba. And sir, we're really glad that you are here with us to just spread the knowledge across the borders. We are so glad.
Yeah, no,
So
thank you. I really appreciate you guys having me, and Madam Guljas, thank you for having everyone organize this. It's a pleasure to be here. Part of much of our conversation is going to be really just talking about AI and how that has reshaped healthcare. But rather than just healthcare, I'm also going to talk about how AI is a big part of medical education now, because that's where we are all at, right? So as Ubed just said, Monday was a life-changing day for me. I was sitting there at 10 a.m. in the morning, fasting. It's just like the hunger is hitting, the sugar crash is hitting, and then as soon as it turns 10 a.m., I hit refresh on my NRMP website, and boom, I matched. So humongous plus of a day for me. I matched into primary health care. And in the long run, I aspire to basically provide world-class primary healthcare with some focus on addiction medicine, because that's a pretty big conflict in America. But as Ubaid was listing out my CV, it's interesting to see the number of hats that I had to wear to get to here, right? And all of those hats were devoid of ChatGPT and other AI features that exist now, right? I mean, even historically, people have achieved so much without the AI features that we have there now. So for all of us, there's no excuse to be able to achieve any less, right? We should be achieving even more than people before us, because we have things like ChatGPT, Gemini from Google, we have Grok from X, which was formerly known as Twitter, many different forms of AI support that really guide us through what we need to do. Um, so without any further delay, I want to dive right into everything we're going to be talking about regarding USMLE, how we can use AI to be better as medical students, and then also how we can use AI to be better doctors in the future, which is what you should be training yourself for already. So first thing we're seeing here, just a quick about me, much of which Obed already covered, but one of the things I wanted to say was my core feature is that I really enjoy clinical trials. Clinical research in America is a $7 to $10 billion industry, which is a number that pretty much goes over everyone's mind. Like, what does $7 billion even look like? But that's how much it costs all of America to really maintain clinical trials, getting patient recruitment, keeping patients in the study, funding the study, making sure that all the regulatory things are managed for the study, and the list goes on and on. And this is all significant because previously we had to hire a lot of different people to manage all of this, but AI is much better at just really maximizing how efficiently it all works. The middle here is a picture of what NYU Langone Health's logo looks like at the building as you're looking at it walking down from Penn Station. Um, NYU Langone Health has been the core of my growth because I went to a pretty small Caribbean school, and that started way back in 2014. So it took 10 years, basically, of medical education and then devotion to different fields to really become the person I was finally able to be that would match. In my time at NYU Langone Health, not only did I work in clinical research, I also did publications with some of the mentors I was working under. I networked with every other department because my ID just allowed me to walk to any door I wanted to. And I did my best to basically become as prominent of a feature as possible, which earned me very valuable letter of recommendations, right? Because NYU Langone Health is one of the big academic hospitals, not only in New York, but in America overall. So getting any letter of recommendation from someone there is just a very significant matter. And now today, because of all of my resilience, I am a resident at Arnold Health, which is right here in New York in the upstate area, which works out great because it's like a 4.5 hour drive from my home, so I can come back whenever I need to. And that's a basic summary of a few of the things that I've been doing. But one of the other things I've been doing a lot of is ever since 2018, I started my YouTube channel, UAssembly Live, where I basically just to teach myself, because the best way to learn, in my opinion, is to teach. When you start teaching something, you just start becoming better at it. And I used to make full lectures for step one, and I was doing it with just a few of my friends, and they told me, post it on YouTube. This is actually ending up pretty good. So I ended up making even better lectures, started posting them, and it just started blowing up very quickly. So now we see that USMLE is just not the same as it was. Step one is not the same as it was when I took it. It was numerical, now it's pass fail. And the difficulty level of all these exams is also significantly improving. And it just so happens that the timeline of how step one is becoming more difficult matches with how AI is growing. So over the past few years, first foremost, which most of you probably know, step one became pass fail in 2022. This was a moment of joy for many students initially, but it actually ended up being a double-edged sword. A lot of students were excited, like, okay, great, now that it's pass fail, I don't have to worry about getting a 260, right? That used to be the prestigious thought when I was taking step one, that, oh, I have to break 250 or some numerical value. Now you just need to pass. That ended up actually reflecting in a lot of students' scores where more students started failing step one. And that somehow actually ends up working out in some of our benefits because so many students started failing step one, including American grads, that many residency programs don't even filter out pass fail step one anymore. Because if they did that, they'd be filtering out a lot of their own American students, and that just wouldn't go too well. Step one also has more soft skills in there now as opposed to patient management questions, right? So instead of asking you, oh, this person has dilated cardiomyopathy, what might be the best next thing to do? It'll ask you how you should tell them. What's the nicest way to tell them without breaking their heart or causing them more distress, etc. And that kind of soft skill, if you think about it, between the two types of questions here, a soft skill question versus a management question, if you were to pose these questions to ChatGPT, which we're going to look at soon enough, ChatGPT has a more difficult time managing soft skill questions as opposed to a logical question of what's the best next step. ChatGPT definitely knows the best next step. It'll tell you very fluently and very perfectly what should be done, but it won't know efficiently how to say it to the patient. And that's a very big deal. In America, you can't just, if a patient has cancer, you can't just go up to them and be like, okay, yeah, you have pancreatic cancer. And that's just not going to end up well at all. The patient's just going to faint, they're going to get mad at you. Delivery of news is a big topic. There's also more step two content in step one, as if step one wasn't hard enough already with the various biochem enzymes, the endless pharmacodynamics of different medications. Now you're going to have some step two questions where it'll literally ask you, what is the best next step? Or how would you handle this surgery? Or why would that breast cancer look different from this breast cancer? Rather than just asking you, what type of breast cancer is it? And that is once again reflective over the fact that, ChatGPT has difficulty with those. ChatGPT, if you start asking it to solve questions where there's a little more complications involved, it will mess up. And oftentimes, what it'll do, something that's really miraculous, is it'll lie. And if you were to tell it, where did you get this information from? Sounds like a lie. it'll tell you, yeah, you're right. It actually doesn't make sense. It's not a fact, and then it owns up to it because it doesn't have the conscience of continuing to lie. It didn't mean to lie, but it's something that happens. So this step one pass rate dropping by 4%, that's a huge percent. You have to keep in mind we're talking about millions of people all over the world that take step one. Right, so when you have a 1% drop in millions of people, it's a pretty big number to begin with. A 4% drop is something that's pretty ground shaking. And to make matters worse, now they've got this new My USMLE portal that just launched March 10th. So if any of you are planning on taking step one anytime soon or even this year, definitely worth exploring that portal, getting yourself familiarized, because a lot of people rely on ChatGPT to kind of walk them through, hey, what should I do next? What form should I fill out next? Now we can't do that because ChatGPT doesn't even know that My USMLE portal has actually launched. It's just too relevant, too recent of a development. So what I'm trying to get at here is generative AI the reason STEP is becoming more diversified? Is there a possibility that the exam writers are using some level of AI to formulate new questions or some level of AI to see, hey, how hard is this question or how hard is this full 260 question test? Is it a good test or not? And if they are doing that, that definitely makes our job somewhat more difficult. So here is a very interesting study. The whole study is online, and you don't have to worry about the numbers that are on the chart. I just put it there, but I'm going to talk about some of the specifics on this. There was a very wonderful study done where they took ChatGPT 3.5, and I point that out because now ChatGPT 4.5 exists, and it's significantly better. It actually has a much better logic algorithm. It has retention of memory, and it can actually recall anything you must have told it a long time ago. It'll remember, in the dialogue you'll have with it. But they used ChatGPT 3.5. They created a whole step one exam using Amboss questions. And then they also had a flock of students take the same test, okay? And they compared how those Amboss students performed versus how ChatGPT 3.5 performed. And as you can see from right here, ChatGPT achieved the best performance in behavioral health questions, right? About 78%. That means that that's how many questions they got right from 100% of the behavioral health questions. And the worst performance was in cardiovascular system, which kind of matches up with the common student, right? Most of us, when we're studying step one, if we go down the way most of us do, which is straight down from top to bottom on first aid, the first thing you hit is cardiovascular. And it blows you away because those questions are going to tie in some renal, it's going to tie in some respiratory, and it just gets more and more complex as you tie in some pharm, all the antiarrhythmics and so forth. And just like most med students don't do too well, neither did ChatGPT 3.5. These kinds of statistics being out there allows USMLE and NBME to figure it out. Like, okay, so if we're making a test, maybe we should throw in more cardiovascular questions if you want to make the test hard, or if you want to make the test easy, just throw in more behavioral health questions. Does the patient have some kind of psych disorder, or is this a child who's having just adolescent difficulties? And those questions were very logical and straightforward for ChatGPT as well as the general AMBOSS students. In fact, here we can see some other stats that we use to see how ChatGPT performs when given questions. The table on the left, you can see it's a comparison between AMBOSS versus ChatGPT performance, and it's based off of whether or not there was a patient age given in the question. And almost every question you ever solve, whether it's UWorld or your real step, will have some age. And you can see that for the most part, there isn't any crazy discrepancy between how AMBOSS students performed versus how ChatGPT performed on any age group, except you could see in the elderly. Most of us don't really understand the really elderly people either, and we're all going to get there one day and be like, oh, this is what happened. This is why they were acting this way. But ChatGPT doesn't understand these elderly questions either. Only 45% solving rate versus almost 10% better solving rate in performance in the AMBOSS group. That's really significant. That shows that ChatGPT was having a little difficulty figuring out which the topic of Beer's criteria, right? Like what kind of medication you should not give someone that's too old. Maybe you shouldn't give a benzodiazepine because it'll cause some delirium and so on. These little more logical topics became a little difficult for ChatGPT 3.5. On the right side, we're seeing questions by category. And you can see how social sciences were something that students were really good at, right? It takes some practice. Same with behavioral health. The social sciences and behavioral health were something that most students were very good at. And to point it out, these were all American grad students. So social sciences and behavioral health while you're in American hospitals is something that's very straightforward, and you just pick it up because you're practicing it, right? Biostats was actually pretty good too. Surprisingly, even ChatGPT faced difficulty with biostats, and that was something that was very interesting to me. Being someone with a math major, I was a mathematics focus under in my undergrad studies. It was really wild to me to see that ChatGPT is the one that was struggling more than AMBOSS students with biostats. This is actually lucrative data also. If I was USMLE and making questions, I would want to put more biostats and epidemiology questions in my step if I wanted to make the step exam harder. In virtually every other field here, ChatGPT just has more difficulty than AMBOSS, right? These group of people that took the AMBOSS questions. So what this basically tells you, and this exam, by the way, was after step one became pass fail. What this basically tells you is that step one has become, without a doubt, much harder if ChatGPT is also struggling. However, ultimately, ChatGPT 3.5 did end up passing, and although a study wasn't done where they collected all this information, ChatGPT 3.5 passed with about a 61%, which was enough borderline passing. But ChatGPT 4.5 on the same exact test of questions performed in the 80% range, which if you were to put a number on it would come out to about 260 to 270, which is really remarkable. Now, depending on what's being used in the background, because we're never going to know about it, things are going to become either more difficult as we go along, or something wild is going to happen and new things are going to come out, which of course adds to our difficulty as well. So all in all, it looks like there's no avoiding things becoming more difficult. So how do we prepare? What can we do besides sitting there with our books, listening to our professors, doing a little bit of research online? What else can we do to really see how to improve? So over the last few years, I would say I've been working on a couple things. ChatGPT allows you to make your own bots. You can all do it. It's not a feature that requires any kind of special permission or something. And I started working on two of my own. The first one here on the left is called desideratum. That was actually an interesting word. So I'm signed up for these emails I get every day, and it teaches me a brand new word. And desideratum was one of the word of the days for me, which basically means something that is wanted. And I thought it was a cool word, so I named this app Desideratum, which is basically a pocket therapist. It's a chat GPT that you can literally open up and tell, hey, I've been feeling really moody lately, I've been being very aggravated, etc., etc. Really break down why you might be feeling that way, and it will effortlessly guide you through how to improve your mental health and just be better. And I've actually tested it out with about 13 of my close people that I know because I can't put that one out publicly yet, and it's been really efficient. Like the feedback was more than just them saying nice things because they're my friend. They were really wowed by it, and two of them are still using it because they'd rather do that than go see a therapist, which takes up time and is just money as well. The middle one is what's most intriguing for you guys, and I'm going to have another slide later on where I break it down even more. The USMLE Live GPT is public. This one can be accessed by any of you. You can look it up in the GPT store. And it is basically your free personal question bank simulator. And I'm going to show how it works in an upcoming slide. You can tell it to make questions. It will make a question just like UWorld, and then you can solve the question and it'll explain everything. It'll teach you everything. It'll even provide resources if necessary, and you get to see the kind of questions a GPT is creating, not a question that's been made on UWorld or a question that's out there on Amboss. This is a brand new question that it is creating on the spot. Took me quite a while of time to feed it, a lot of information, feed it knowledge. I had to feed it a bunch of different PDFs, and ultimately it's still a project under work, but it's free. It's free compared to paying 300 to 400 bucks for UWorld or the other hundreds of bucks for Amboss. This works efficiently, and I'm going to show you that. And the right side is the logo of the school that hired me to basically help their step students pass. It's a pretty relatively new Caribbean school, and they needed someone to basically make sure all the students are getting through step one, step two, and into match, because that's how Caribbean schools receive certification from American accreditation. So as the director of student success there, I've been using a lot of ChatGPT with the students and encouraging them to really learn things from the way ChatGPT tries to explain it, because it's often more summarized, it's much more friendly, and it's on your own pace. So what we're seeing here is a live action use of the USMLE Live GPT. So it's starting off in the first area. I wrote here, hi, can you please create a step 2 CK question for me to practice and study? It went ahead and said sure, and it made a full question. Now, this question is a fresh question that isn't out there. It didn't pull the question from any QBank or something. It made it on the spot using whatever knowledge it has, right? About a 65-year-old man with hypertension, diabetes, hyperlipidemia, and so forth. And then it gave answer choices. I took my time reading it, and then I went ahead and chose an answer. And I knew the answer, so I chose it, right? The answer being D, perform a CT angiography of the chest, and it immediately told me correct. Now I'll stop here. There's a very fancy thing it does, but I didn't want to take all the screenshots it would take to explain that one. But if I had chosen the wrong answer choice, like A, obtain an ECG, it would then tell me, hey, that's not the correct answer, but take a moment. Now that you know A is not the answer, what do you think is the correct answer? This is something that I taught the ChatGPT to do, my usefully Live GPT to do, because it's different from UWorld, it's different from any other QBank out there, where as soon as you pick an answer, it'll instantly tell you if you're right or wrong. This one gives you a chance to redeem yourself, essentially, where you can now, maybe you were, this often happens, maybe you were confused between two questions, so two answer choices. So you could go ahead and now pick D. Maybe you were lost between A and D. You go ahead and pick D, and then you now see what comes forward. It goes ahead to then explain the rest of the explanation for the question, and it breaks down how the other answer choices are wrong. On top of that, it'll also sometimes explain to you, if you ask it to, where would the other answer choices be correct, right? And this is all ultimately going to be very effective studying, because you'll have mastered the topic that's in this question about ordering a CT angiography. And it summarizes it all off in the end here with key learning points. I did see a hand being raised. I think I'm okay with questions if anyone has any thoughts or something that you want to ask. So, Obed, whatever you think is best, I think they can just go ahead and, when they're raising their hand, they can go ahead and ask, and I'm ready.
Um, Nadia and Bashir, if I'm not wrong, you both raised your hand. Do you have any sort of questions? Please let me know. And if you have any sort of question, you can also directly inbox.
Mm-hmm.
So Mr. Amir Malik also respond to you.
Yeah, I have the chat open as well. But feel free to
Mm.
ask here. We can take a quick, little pause here. Either one of them can ask whatever the thought might be, and we'll talk about it.
Yeah, I guess we better need to move.
Okay, no
So
problem. That's fine. Then they can put it in the chat as well. And if anyone
sure.
does want to ask a question, just raise your hand, let me know, and then we could just talk about it. But yeah, this was basically the demonstration of how the USME Live GPT looks like. Personally, this is something I'm still working on. I'm trying to make it more improved. I'm adding more features to it, but this ends up being something that's very optimal for any country that can access ChatGPT, because if your country can't access it, because there are some countries that can't access it, you could try using something like a proxy or whatever to change your location. It gets a little more complicated, but it works. But ultimately, once you're in this bot itself, you can just keep creating questions. And these questions, in my opinion, are going to be reflective of what's going to be coming up on your real test as well. Because the same level of Q banks that were out there have actually become a lackluster issue ever since, if you've heard about it, ever since that major discovery of cheating that was happening. The allegations were against a few students in Nepal, right? That issue ended up causing all of USMLE and NBME to kind of just delete their questions, delete the whole Q bank and all of that, and make brand new questions, which, believe it or not, is a very, very difficult thing to do. Because if you're writing a question, if you ever tried it, give it a shot. When you're writing questions and you're putting together answer choices, it is so hard to lead the student to the correct answer choice without making it too obvious. So they've been working on that, and I can't imagine they're not using AI to formulate questions. So then comes the topic of what do we do about studying, right? Because we've all been using some of these same resources for the longest time, and without these resources being as significant as they always were, what are some of our options? Well, we've always had first aid, we've always had UWorld and Amboss. Anki was a slightly newer thing, and a lot of students really enjoyed making those decks that kind of made you focus on uh, recalling things from your own mind. NBME has those CBSE and CCSA comp exams. Those are wonderful. That's something that's been there for a long time as well. And of course, Kaplan, Boards and Beyond, and the list goes on, right? There's Pathoma, there's so much more out there. But at USMLE Live, I have my own PDF, which is kind of a combination of everything, and that's where the lectures also became very famous. I'll go through cardiovascular while also simultaneously talking about UWorld questions. I'll throw in some Amboss images and questions. I'll often throw in NBME questions because they seem to be often worded in a very weird manner, often bringing up topics in a point where STEP won't do it that way. And I'll even tie in key anecdotes from Kaplan, Boards and Beyond, or even my own personal experience in working at different hospitals. I've worked at NYU Langone. I've worked at Montefiore Hospital for about 6 months, which is in Bronx, New York. And then even now, I'm participating with a couple of hospitals here to just get more patient recruitment. Clinical research is a big topic for me, and I like trying to help improve that aspect of things. So you start seeing that when you tie things in this manner, even when you're studying for your own topics, it sticks to you better. You want to remove one very important thing from your studying. You want to remove monotonous activity, right? Anything that is monotone. If you're doing something that's just singular, like just reading or just going from one page to another page and all the pages look the same, your brain will get dulled out, you will get tired. Then you might push yourself to kind of just get through something and it won't stick to you efficiently. Later on, you'll try to come back and revise it again, and that'll add to burnout because you'll be looking at the same thing again, and your brain doesn't want to look at it, your eyes don't want to look at it, your heart doesn't even want to accept it anymore. So, looking at things in a manner where you keep switching up what you're looking at has been something that makes sense. It's just been very effective for all the students I work with. I tell them, you're reading first aid, okay, but don't just stick to it. Keep changing over to UWorld, go over to Amboss, do a question on that topic before you move on to the next topic, right? So if you're reading, for example, hypertrophic cardiomyopathy versus athlete's heart, find questions on it before you move to the next topic, which might be hypertension. Because if you just keep reading all of these topics, yeah, you're learning it, but you will start feeling the monotonous activity that will slow you down big time. And it's worth avoiding that aspect. And with the GPT that we have now, after every single topic, you can tell it. You can tell it, hey, I just finished reading dilated cardiomyopathy, or I just finished reading aortic aneurysm. Can you give me a difficult question or an easy question? And it'll really curate these questions for you, explain it to you, and make sure that you've mastered the topic before you move on to the next topic. Really just making your time much more valuable. So now that's all about AI in healthcare and studying. Where else is AI being used that's significant in America? So AI is becoming a leading investment in clinical research. It's got more and more money being poured into it every single day because with AI, with automations, things just become more efficient and errors start falling, right? So here you're seeing a few different sections where AI is used, and I've had the pleasure of actually being involved in these because of working in big industries that are doing clinical research. So the first part being regulatory submission. Regulatory submission is what usually takes up the most money when you're trying to start any kind of clinical trial in America. And talking to the FDA is not fun. It's literally like talking to that mother-in-law that you really don't like or the mother-in-law that hates you. It's literally sitting in front of someone that is just there to judge you so hard that you're probably gonna end up pissing your pants because they don't even let you record it. You have to pay thousands of dollars to sit in front of them, and then you're gonna bring up all these topics about your little study that you're trying to do and how cute it is, and they're going to tear it apart and they're going to tell you it's full of biases and it's full of different issues that might come up that you may not have even seen. But thankfully, ChatGPT can see it. So when you're coming up with your clinical trial now, ChatGPT and most of these other AIs like Gemini and Grok, they can actually go ahead and break down the whole discussion for you so that when you go in front of FDA, you know exactly how to talk, exactly what points to bring up, points not to bring up, because it is a very legal discussion. And when it comes to law, the best thing you can do is just not talk in America. So not saying certain things is more valuable than saying certain things when you talk to FDA. And this training isn't something that any of us really get. I mean, in America, us medical students, we don't get training on how to talk to FDA. So when it comes to non-US international medical graduates, it's nearly impossible. Like, we've all heard of FDA at some point, the Food and Drug Administration, but we don't really know how it works. We definitely don't know how to submit a protocol for approval, and those things are a big part of being a doctor. Now, many things make it very difficult for international non-US students to get residency here. As a program director, assume I was one, if I'm a program director of an academic university, right, I want to recruit residents who are going to do clinical research, who are going to go ahead and involve themselves into AI, who are going to be able to improve patient outcome, quality of healthcare, and so on and so forth. And
Then
and many times it just doesn't happen, right? We don't find international students who are capable of having that understanding because they wouldn't know how to. They wouldn't be able to access this knowledge base. They wouldn't even know what's missing. So how can you work on improving or fixing it, right? Um, the next thing here, data analysis. Probably one of the most difficult and brain shattering parts of any clinical trial. You're going to have research on an oncology study, and it's going to involve maybe 50 different patients across different parts of America. And now you're going to have to put together data on how they took the medication, different side effects they had, their cell count, neutrophils, etc., etc. Looking at all that data efficiently is very important. Now imagine you got a protocol approved, maybe it cost you millions to get it done, or maybe it cost you $700,000 in loans to get it approved, and then you get really bad data because the people you hired just didn't do a good job cleaning up the data or taking good data. Without data, every trial is just a complete mess. And data often tends to be the number one place where clinical trials just fall apart. So that really sucks because if they had data and had they just collected it the right way, it would be efficient, it would be meaningful, and the money would be worth the investment. So now AI is kicking in on taking all of this data from every single patient. We give them iPads and they enter their information into there, whether they missed a pill or if they had a side effect of vomiting, and their nurses are going to help them enter all their clinical data with their neutrophil count and how their lymphocytes are doing, and all of that gets stored and analyzed by AI, and then it gets organized in a very efficient manner so that we can compare these different patients, right? Data management, same kind of thing. And then study design. When you sit down to make a study design, when I first sat down to do a study design, I had no idea where to begin. The best thing I could have done was look at old study designs and try to use them as a skeleton, and then try to put in my own things in there and just go ahead and make a protocol and then go submit that to FDA. All of this is far more easier to say than it is to do. And it was nearly impossible. I had to recruit so many different people within NYU to help me just do one simple protocol. And when it finally got done, I had to revise it about 3 times because of what FDA thought. Today, though, if I had the ability to use ChatGPT 4.5 to create the same protocol, it would probably take me a fraction of the time. But ChatGPT isn't just magic. You have to know what to ask it. You have to have the input for then to get the output from ChatGPT. So, for someone that's never heard of any of these things, ChatGPT may not be as much of an asset. This is why I'm saying that not only do you need to learn how ChatGPT works and how design algorithm and language are a big part of it, but you also need to learn, right? You need to be aware of these things, because if you're having an interview from an American university or in any American hospital for residency, and you're able to talk about clinical trials and you're able to mention how you want to improve recruitment or improve patient retainment, any of these simple things that are very complex here, it's going to be a huge wow factor, because imagine how many other of your colleagues or other non-US IMGs are going to sit there and talk about clinical trials. It's not really a common thing. Most non-US IMGs are just going to talk about the academia. They'll talk about the observerships they've done or any kind of clinical publications they were able to get, but they won't be able to talk about actual patient recruitment, getting data, how to analyze that data, putting out publications that others can utilize, and so on and so forth. Ultimately, all of this comes together to help you do the study setup and trial management. These two things are what I do, right? So when I was a research coordinator at NYU, my job was to put together the study setup, make sure that the database is ready, put out all the mapping of how things are going to occur when a patient comes, to all the way in the end when the patient is done with the study, a lot of things in between, and put together the case report form. So every patient's case is there, right? What happened with this patient? What happened with that patient? Why did this patient come in and die, if they died, right? Or why did this patient come in and decide to not be in the study? And then, of course, trial management. That's the other thing I do, making sure that we pick the correct locations to run the study. We get patient enrollment in a very effective manner. And that's a point I'm going to elaborate on a little more. Risk-based monitoring. Now, monitoring is a hell of a thing here, but basically it's a form of auditing. So I go and check on all the data that's being collected to make sure it's being collected in a very ethical manner, and that no one is kind of making up data and all these things. It's a very almost policing type of duty to do, and no one likes that. So whenever I'm visiting, I'm not their favorite person, but I have to do what I have to do, right? And then the last thing here, chatbots. But this patient enrollment part is a big part. Enrolling patients into a study is extremely difficult. I mean, there's two types of studies out there, right? There's phase 1 and 2, where those studies are trying to see, does my medicine even work? So I'm going to pay you to be in my study so that you can provide me data about how does my medicine affect the human body, right? Those are easy because people will come in and enroll if you're paying them. So if you pay them for every single visit, maybe $30 to $70, they'll sign up, they'll stay in the study, they'll complete the study, and they'll be happy with the money they earned. You'll be happy with the data you collected about how does your phase 1 or phase 2 medicine affect the human body. Then there are trials that are phase 3 and 4, which basically help the human body because you already know that the medicine works and that it is a treatment, but you don't know how bad it might be or any other random things that might exist about its safety and efficacy. For those, the only way you can get people to enroll is if you find patients who need that help, right? So, for example, if you have a trial for cirrhosis of the liver, you will need patients who have liver cirrhosis to sign up. However, many of them may not sign up because they don't want to be in a trial. They want to be in something that is proven to work, right? Some of them might not sign up because they're just too sick to be in a trial. Remember, being in a trial is more than just a normal treatment. You're going to have to keep coming back to the clinic for me to take your blood, for me to take your urine, for me to measure your liver ultrasound, because I need all of that data the whole time you're in my study. So those studies oftentimes don't get enough enrollment, and to be able to find good people to enroll into these studies is something that AI is helping with, because AI is recognizing how severe is somebody's disease, something that we're going to get to soon enough too. Literally, we have now AI software that can identify, oh yeah, this person is going to have breast cancer in 5 years, but at the same time a radiologist looking at their mammogram will be like, no, they're okay, send them home. So that difference is huge, right? Because if I can identify someone is at potential risk of breast cancer in 5 years, I can save their life, right? But if I don't do that and my mammogram reading, I think that they're okay and I send them home, later on they develop breast cancer, it might actually become too bad for me to do anything at that point. And that is one of the bigger applications of AI in medicine, right? AI is rapidly transforming healthcare in so many ways that in the last 3 years, in my time within hospitals, I have seen NYU look from a certain way when I first came the very first day to a whole different operating theater. See, I was working for the Department of Vascular Surgery. Now, vascular surgery is big money, big surgeons, everything big, right? People with aortic aneurysms to people with deep vein thrombosis to carotid atherosclerosis. All of these people are coming to vascular surgeons to get treatment. But NYU is an academic university that also does a lot of clinical research. So these people would enroll into trials using different kinds of medical devices that would promise a better result, better outcome. And seeing how AI was mapping different things, like we had people who got MRIs done, and then AI would look at those images and just turn a 3D diagram of the MRI of the aorta measure the diameter, measure the length, measure all these different things in there, and spit out a number of how effective this trial might be for that person. And it's almost always correct. It's insane to see all of that. Diagnostic algorithms and imaging analysis, drug discovery through data sets, prognostic AI models, and wearable devices for patients monitoring and health detection. This last one, the wearable devices one, is something that's become extremely significant because Apple has been adding that to their watches, right? Apple has ECG detection. It can detect AFib from you on the watch just because you're wearing it. The Samsung watch also similarly has full ECG access now. We're coming up with hearing aids that are able to do a lot more. Application of AI in medicine is growing so much that in upcoming interviews, and I did this in my interview, but in upcoming interviews for residency, you need to talk about something you're looking forward to doing that involves AI in healthcare. The thing that I got to use at NYU was a portable ultrasound device. It had AI in it. The way it had AI in it was that it was actually through Bluetooth, it was connected to a phone. It was called ThinkSono. ThinkSono Ultrasound Handheld Butterfly, they call it. You could do the ultrasound just because the phone app was telling you how to hold the probe. So if you've never done an ultrasound, you would still know. It would tell you to press harder, it would tell you to angle in a certain way, and because you're doing everything it's showing you in the phone, you get a perfect image, and then it'll even show you the image and it'll say, yeah, this is a good image, take a picture here, and then you click the button, it takes a snapshot, done. You just became an ultrasound tech without having to get any of those ultrasound courses and really just even being proficient at what an ultrasound is. That was extremely fun for me, and as you may know, they call it POCUS, which is point of care ultrasound. Point of care ultrasound is a big part of what you do in PGY1. Learning how to do point of care ultrasound in your first year of residency is one of the key features of residency. And if you're good at it already, which I feel like I might be when I first start June, inshallah, then I'm excited. I'm excited to kind of show that skill off and maybe even teach some of the other residents and start kind of growing myself and grooming myself to eventually be chief resident and so on and so forth, get good letter recommendations from my program director, and really just grow more and more with time. Here we're seeing what I was talking about, right? So you can see this is basically doing an echo of the heart, and AI is outlining each of the chambers, and on the bottom right you can see some data it's spitting out. On the top right, you're seeing a beautiful image it's making of how it sees the heart, and it will then give you what it cannot call diagnostic information, but it is. See, regulatory bodies in America prevent software from saying, hey, the diagnosis is X, Y, and Z because you can't sue the software, right? So software is not allowed to give a diagnostic information, nor are medical devices. They can only suggest things. So as a physician, you take that suggestion and then you really weigh it. Okay, is this relevant? Is this realistic? Or is this a mistake by this AI software? And this image that I'm showing you here is actually from an app that's being created that's trying to predict patients who might be at risk of having a heart attack or heart failure. And it will tell you just from one ultrasound of the heart, looking at the entire heart, doing a good echo, it will be able to tell you, hey, this patient is at risk of having a heart attack in the next 5 years, which then helps you tailor what medication you're going to put them on. You could give them more statins, you might be able to give them more beta blockers, whatever is going to work. Maybe you need to do a carotid atherosclerectomy and take out something from there to make the blood flow better, right? Maybe they need a new heart valve, aortic stenosis. All of that is going to come out just from this one ultrasound, often making it scary to imagine being a radiologist, right? But thankfully, the software alone cannot give you a diagnosis, so you still need your radiologist to look at it and say, yep, that is correct, and we're going to go with that, which makes it easier for them. And oftentimes, you would think it makes it easier, but oftentimes it makes it a lot harder. Being a radiologist is still very prestigious and very difficult because this software may say, oh yeah, this patient is about to have a heart attack in 2 days. The radiologist is going to be the one that knows the human as a full picture, right? Keep in mind, this AI software is only looking at one thing, the thing you fed it, which is the heart. It doesn't know that this person may have had a divorce 2 days ago, which is a huge deal for cortisol elevation, Takotsubo cardiomyopathy, heartbreak syndrome. Those are all real things, right? It may not know that this is actually a 65-year-old person who has hypertension, diabetes, hyperlipidemia, major morbid obesity, all these other things, and it's spitting out information to you just based off of what was given there, right? That image. So the radiologist is the one that takes that image, takes the information from there, and then associates it with the whole human as an image, and can then say, yeah, the software is saying you're at risk of heart attack in 5 years, but you're actually okay. None of that is going to happen. Companies like ThinkSono, EchoNose, and many others are investing millions every day to come up with ultrasound software and AI involved ultrasound devices that are going to help do these things more efficiently. And all of these are things you want to be ready to talk about, not just in your interview, but even before that, because you may not get the interview until you talk about it. You could put it in your personal statement. You could put it in your CV that you even attended this talk about AI stuff, and you got to learn about all these things that made you more intrigued in looking into it. It's a huge thing to be able to hear any kind of discussion about something. Here I'm showing you my own data. So for match, I got a gift. I got the Echo stethoscope as one of the gifts for myself, and you can see what the steth looks like. It's a pretty cool steth. It's got this really big round dial that actually shows you ECG readings on the steth, right? So it took 200 years for the stethoscope to finally evolve, right? The very first steth came out in 1816. That little stick you're seeing on the right is actually one of the original stethoscopes. It was something that would be used like almost like a telescope. You would put it to your ear and you would attach it to the heart on the other end and just listen to what you're hearing. And it worked. It did the job. People could hear the lub dub. People could hear some of the really severe aortic abnormalities. But now we have the echo stat that not only identifies heart sounds and sees that everything is normal. This is my own ECG as well. It has leads 1, 2, and 3 in it. So when you're doing, I had to sit down. Well, I had to lay down and do it to myself and see how it sounds and everything. And thankfully, right, I have a normal sinus rhythm. I have no murmurs detected, and there's no fibrillations or anything else either. By looking at leads 1, 2, and 3, you know that inferior MI is seen in 2, 3, and AVF. So 2 and 3 would show you some level of ST elevation. And then, of course, just knowing that there's no crazy fluttering or any kind of abnormality. You can see it's very uniform, very pretty. I like it. You know that there's nothing wrong with my heart. But if there was something wrong with my heart, it would be very clear here. And it would be much more effective than using just a basic stat, which would really just hear a possible murmur, but it can also miss the murmur. And you may not hear it if the person is talking, if someone's walking around, like the nurse is taking a few steps in the same room, or if you're doing pediatrics, oh my god, you cannot hear anything but the baby yelling when you put the step on their chest. So this becomes something that really amplifies the sound, and you can record the sound as well. So you can listen to it outside without the yelling that's happening. And it just really does a really good job. And this has been a huge success. This step is extremely expensive. And not only that, there's also a subscription model attached to it, because you could pay a monthly price to have every single patient's data saved on the phone app. So it's a beautiful thing. I'm excited to start using it when I start my residency, and really just accumulating patient data, getting their permission for their data, and eventually using it for clinical trial and case reports in the future. Something that, again, is something you want to mention in your interviews, right? You want to mention that as a first year resident, you're going to be doing case reports. You're going to be gathering. What is a case report? Basically, I'll give you the basic idea I have. I'm going to look at the heart of every patient I ever get in my first year, and then just make a report of how did everyone's heart look. That's it. There is no such thing as bad data. So any data you could put a case report on is meaningful. So when I put out that first publication in uh, about a year and a half from now, it's literally going to list out, the location is Elmira, New York. How is everyone's heart at Elmira, New York like? And how many people have tachycardia, bradycardia, etc., etc. And then it's just going to be basic statistics. And that data can be used by someone else in the future if they're looking for how are cardiac events looking like in people living in remote areas, because Elmira is far from the city. So that's stuff you want to talk about doing. You want to show your, interviewee that you want to do stuff like this, and it becomes very, very intriguing. Now, that being said, I've been talking a lot, and I will definitely feel my rosa tonight because I'm like beyond thirsty. But yeah, Ubed, I wanted to kind of open this up to any thoughts, any questions anyone has, or if anyone messaged you any questions, I'd love to talk about it.
Yeah, I just received few questions through
Okay.
my mail. Students used to ask about the especially article writings and the research writings. They are talking about how we can use the artificial intelligence is systemic reviews, the meta-analysis, case reports. So, do you want to mention
Yeah.
some?
Yeah, sure.
Yeah.
So I would say at the time it doesn't work really well for any of that because first of all, if you've used AI enough to make it give you answers, it loves typing with semicolons and it uses hyphens and stuff like that. And some of the way that AI types when it gives you essays and stuff like that, it makes it rather obvious that you were using AI, which you don't want to become famous for. You don't want to become notorious for putting out any kind of publication where everyone is like, "Oh yeah, this student definitely used AI to make this." Because it takes away your credibility, right? Now, can you use that as a template to then do your own typing? Sure, but you got to be very careful with that because, as I said earlier, it does lie. So ChatGPT does often come up with data or connections or thoughts that just aren't correct. And when you're putting together something like a systemic review, it's more work than it's more work to use AI for the systemic review than it would be for you to just do it yourself. I've done 3 systemic reviews, and I can promise you the first one I used a lot of ChatGPT. I tried so hard. I uploaded all, so it was a systemic review about testing whether or not there's a difference between getting a DVT in a proximal vein versus a distal vein. In these two groups, how did these people end up 5 years later? Do they get another DVT or are they okay? It was a very simple systemic review, and I had like 17 articles that I was going to do the review from because they were all looking at the same thing. I fed all 17 articles to ChatGPT. I let it soak it all in, really, marinate it nicely. And then I told it to give me the information, and it started spitting out some very fascinating things that were not factual. Okay. And the reason I found out was because, like a silly little man, I printed that out and I brought it to my mentor and I was like, hey, how does this look? And I was very clear about it, though I told him that I used ChatGPT. And he went through and he was like, "Oh, this is very interesting that you told me you use ChatGPT because a lot of the stuff here is not a fact." And then he spelled out the things that were not facts, and I was like, "Wow, so that's not gonna work." What was I just saw a question, but I can't open it right now. What was the follow up to that?
Before going to
Yeah, please.
going to the, there was a person who just raised the hand.
Yeah.
His or her name is not mentioned. Um,
My name is Dylan. I'm from IMU. Good evening for everybody. My question is just we as doctors and as healthcare professionals, can we 100% rely on the AI for diagnostic and that health latest shifts with things like that? But that just relying on the AI doesn't make us being lazy for getting information from another sources.
That's a great question. That's actually an ethical dilemma that's been coming up a lot. But let's be honest, right? If we have something that's there that can tell us something and help us do our job, then it's not laziness. It's resourcefulness. We do this with each other. If you and I were working in the same hospital and we're both talented cardiologists, I would come to you for consultation. Like, hey, I have this patient. I think that they're about to, or I think they need surgery for the left carotid artery. What do you think? And you might go over it and be like, no, they're okay. Don't do it. That's the same thing as going to ChatGPT and consulting with it. There really isn't much of a difference. And if ChatGPT was able to see something that you didn't see, it doesn't mean that you were lacking in your knowledge or something. It just means that ChatGPT was able to see it. That's it. There's no next level breakdown there. So when we had the ability to use AI to come up with some kind of diagnosis or some kind of new discovery, it's a privilege to be able to do that. It's a beautiful thing, and it's a great collaboration between human and machine. And we should utilize that safely in the sense that don't trust everything it says, right? So just because AI said it, You don't just do it, you use that in evaluation of your own understanding. So I hope that kind of makes that idea a little more clear.
Thank you so much.
Yeah.
It's clear now, but I have a second question, if you
Okay.
don't mind. My second question it is most of the students, especially medical students, they are just using ChatGPT for reviewing topics and systematic of if it's like a respiratory system or cardiologist or a neurological system, they are relying too much on ChatGPT more than they are just they have confidence or themselves for being studying in books.
Mm-hmm.
How about this? I'm just wondering if relying 100% on ChatGPT and AI for studying, it will be really have a good benefit, but it's still when they have actually meeting in the hospital, meeting the patients, they will just have less confidence to treating the patients. That's why I'm just having issues of the ChatGPT. They will take control of the confidence of the doctors, of future doctors, on the students of the healthcare generally.
Okay, no, that's actually a very fair thought there. Um, when you think about it, we've all probably done it at some point. I know I have. That when something comes up, I was studying with ChatGPT, I was relying on ChatGPT, but never in life should we rely on anything 100%. And that never happened. I never relied on ChatGPT 100%. I also never felt like ChatGPT took away my confidence. If anything, it gave me confidence. But there is a risky point there. If you rely 100% on ChatGPT, then one day ChatGPT might tell you something that's a lie, and you'll go out in front of all your other colleagues and say that lie very proudly because you 100% rely and believe ChatGPT. They'll all look at you and laugh, and that'll crush your confidence. So that's pretty much the only scenario we're trying to avoid, which is why you shouldn't rely 100%. If ChatGPT is one of the tools you're using, that's okay, right? Because then it's a tool that you're using, it's teaching you something. You can go check that against other sources now, and that is the whole act of studying, right? The act of studying is the ability to look at multiple things and research what you want to gain knowledge on. Um, and by doing that in such a manner, you make sure you don't fall for the pits of mistakes. And ChatGPT is just one thing, and it's not like ChatGPT is paying me to be here. So I will gladly tell you that in my experience so far, Grok from Twitter has been much better. The way it talks, the things it breaks down, the information it details, it has proven to be a significantly better AI model than ChatGPT. And then the next thing I'm going to do is try to get more knowledge on how Gemini works, because Gemini is Google's AI software. Gemini is proving to be extremely exceptional at all as well for USMLE things. So it's something that I'm looking at eventually too. But you play around with these things and just make sure you never rely entirely on one resource. And then in the chat, I
That's
also
the best things we do because sorry.
no, no, you're
That's
good.
the best thing we could because we are our future. We are students now in the medical. And we will be our future doctors. We will be
Exactly.
actually going to the hospitals and dealing with the real patients
Yeah.
because relying on the ChatGPT 100% will make us less confident about our thinking and our
Right.
diagnosis.
100%.
My
You
third questions, yeah,
go
my
ahead.
third questions is about clinical trials.
Mm-hmm.
How we could improve that side, how we could improve that side as a student. We are just thinking for applying for USMLE tests. I'm fourth stage in IMU in Kyrgyzstan, in
Mm-hmm.
Bishkek here. I am thinking about taking steps to do a first step of the USMLE test, and I have a lot of resources, but all the resources is so a lot, and I
Yeah.
didn't find my study plan yet. But that ChatGPT will help me to find a quality plan study, or I just be relying on it 50% and 50% for the other resources like step one USMLE books and key banks and stuff like this.
Yeah, yeah. I mean, you definitely want to utilize different resources, but as far as learning about trials goes, I think the best way to do it for someone that's not in America would be to go on clinicaltrials.gov. So clinicaltrials.gov is the international website of America where all clinical trials have to be listed. Any clinical trial that's happening is listed there. When you go on that, you get to look at older trials because that's not confidential anymore, and you could see what was the protocol like, what had to be done. And all of this is important because on step one and on step two and on step three, you will get those articles, right? You get those article questions where they have graphs, they talk about the confidence interval, they talk about how randomization occurred, and all these things. And if you've never seen the full evaluation of a clinical trial and the data that came out of it, it's very hard. Similarly, these same trials are what lead to the pamphlets that are also on your STEP exams. The pamphlet that shows you, oh, there's a new drug that came out. Then there's a graph showing the effectiveness of that drug in elderly people. There's another graph showing the side effects of that drug in elderly people. And then the question is going to ask you, hey, do you think this drug is good for your patient? You have to be able to evaluate that, see the biases in there, see whether or not the data is significant or not clinically significant. All of that comes from really just spending a little time looking at clinical trials, understanding the design of clinical trials, and really seeing what came out of that clinical trial when it ended. What data was looked at and kept, what data was not looked at because it was irrelevant or it wasn't clinically significant. It's a big industry. It's a big part of learning and a major part of medicine. And it's also one of, as I said earlier, it's one of the big things that a lot of international students are missing, which takes away from how much they can shine as someone that I would take as a program director, right? If I was a program director, I want to take someone that's going to do trials, do research, because it'll make my school, my university, my hospital look better, right? It's going to make my whole program look more famous if one of the residents I took goes ahead and does a trial that then makes a new medication in the future. And where did they come from? They came from residency at my school, right? So that's a big thing that will really set you apart from everyone else. Now you don't have to do this too much. You just pick one trial, study it a little bit, see what it's like, and then you're done. And later on you can do it again for a different trial whenever you have free time. It's still medicine, so it's relevant to your own studies. And then I just wanted to really quickly talk about the two questions I'm seeing in the chat. So Akasha Elias asked up to how much extent we should rely on AI, which is similar to the questions we're getting right now. And honestly, it's really just, it's a tool. You're using it to learn things. It's not teaching you like a god. It's just helping you learn. When the time comes that you're in front of real patients, you'll learn different things, right? You'll be growing there too, and you'll be able to apply whatever ChatGPT and other AI models may have taught you. And it also depends on what you're asking AI to teach you. If you're asking AI to teach you facts, that's okay. But if you're asking AI to teach you, how should I approach this patient, that's something that you have to really tailor by looking at not just how effective medicine is taught, but also what is that patient like. If it's a patient that has certain history that matters, like if they're a drug user or if they're homeless or if they're someone that has had HIV for a very long time. All of these things are very significant, and ChatGPT can't really do these complex things very well. So stick to just asking it facts, and Bajwa Noor asked if USMLE Live replaces UWorld or Amboss. Well, at least the GPT kind of does, right? If you're not looking to spend $400 to $500 every 3 months to just renew your UWorld subscription, which in my opinion is very absurd. It's a lot of money for us here, and it's definitely a lot of money for anyone else. Like even a lot of my other colleagues and friends in India, that's where I'm from. They would not be able to afford $400 every 3 months. It's just not feasible from the east like that. But this GPT is free. It's completely usable by anyone. You just type in whatever you want to hear from it, and it will go ahead and do that for you, and then you just move on to the next topic. So I would say that it's not about replacement, but it's just more about using resources to the best of your skills. Any other thoughts?
Hello.
Hi.
Thank,
Hello, Mr. Amir Malik. It's Muskan here. And first of all, I would really like to thank you that you have made us acknowledge from so many things that we were not aware of yet. And the way that AI is being used as a tool in so many aspects of medicine. And it's really amazing to hear that and listen it from you. And the second thing that I wanted to mention is that the students here who are talking about how can we rely on AI. So I just wanted to add a point to it that which I use and it really helps me. So it's like sometimes I read a topic or watch a video, a lecture, and then I just search the topic on ChatGPT. So
Mm-hmm.
I feel that ChatGPT basically summarizes all the main points.
Right.
So it's a rapid revision. It's a rapid revision, and you can have a quick review of everything that you have studied. And if it misses something, you can evaluate your knowledge as well, that it has missed something which I studied. So I think this is really helpful because it cuts your time short. It helps you to retain the knowledge better.
We need to remember, first of all, thanks for saying that this was helpful and it brought you information. So mission accomplished. But we need to remember
Yes.
that ChatGPT didn't exist. We made it, right? So since we made it,
Yeah.
we have to be the ones that judge what it says to us. It's there to help us. We created vacuums to help us clean the house, right? But we have to be the one that
Yeah.
pushes the vacuum. And then even the automatic Roomba robot that goes around the house cleaning the floor, we have to turn it on. So when it comes to ChatGPT, I want you guys to all understand that yes, you're using it, but you're the one that's judging it. So when you ask it some kind of information and it tells you, hey, yeah, you should go do thoracic surgery for that patient, it doesn't mean you're gonna go do thoracic surgery right away. You're gonna judge it. You're gonna be like, okay, ChatGPT thinks we should do thoracic surgery, but this guy doesn't have a heart, doesn't have a mind, doesn't have eyes, has never had a breakup or something, has no kids. So there's a lot of
Yeah.
things that ChatGPT doesn't have, and when it tells you to do something, you got to keep that in mind. The human factor is what we provide when we use ChatGPT or any
Yes.
AI model.
Yeah. That's it.
Yep.
Thank you so much.
Yeah. No problem, Muskan.
Before going to the next person, I firstly really want to thank Miss Muskan. She is I'm working under her umbrella.
Oh, okay.
She is academic head of the student council, and I'm under her in the publications team. And this event is also possible. She's one of those members who really helped me and make it possible. And I officially want to introduce the ma'am Almira. She is our vice director of sciences, and she is also part of our webinar today. Thank you
Excellent.
so much, ma'am Almira, to be part of this webinar.
Yeah.
Thank you, Baz.
And thank you guys for having me. Thank you, Muskan, as well, and Elmira. And that was really interesting to see Elmira because that's also the name of the city I'm moving to. That's where Arnett Health is. So when I saw that name pop up, I was like, oh, okay, that is the exact name of the city of where I got my residency. But that being said, I wanted to just put this one last slide. So when all is done and said, AI shall speak as well. That is the end of that presentation, and just gonna leave it up to talking with you guys and calling it a day whenever we finish.
All right. Before finishing this official webinar, is there any further question? Is there anyone who want to ask about artificial intelligence in our med school, or anyone want to comment? Yes, Gulfam Javed.
Hello, sir. How are you? Uh, my name is Gulfam. My question is about how ChatGPT help us in research department. At that time, till we don't rely on completely on ChatGPT. But what you think about because most of the diseases in our genes, autoimmune diseases and other genetic disease, and how you think it's ChatGPT help us in this regard, in this research purpose? What do you think about it?
Okay, great. So the fact that you asked that question is really cool because I would definitely make sure you remember asking that as a point when you get your interview. Okay, that's a really nice question because when you get your interview and you're sitting in front of a program director and they're just like, so what's something you want to do in the future, or why do you want to do, let's assume you're going to apply for internal medicine. Maybe they'll say, why do you want to do internal medicine? You'll say because you're really interested in seeing how we can use AI to identify genetic markers and improve research in genetic diseases. Because the fact of the matter is, we actually don't know, right? So we don't have that out there right now. The only way you can use AI is if you feed it information. So you would have to put the whole human genome into ChatGPT, load it up as an AI knowledge base, and whether or not that's been done is beyond me. I'm not 100% aware, but I haven't seen anything like that yet. So this kind of critical thinking and these doors that opened up from thinking more and more about this is what you want to bring up even in interviews and as you grow as medical students right now. So, to really answer your question, I'm not sure how it would work, but it's definitely something I'm sure someone out there is working on, and they'll make millions off of that when that succeeds.
Yeah, it's like same things we seen in the most of our immune systems that how much interleukins it's working and how cytokines perform their works, its impact on our lives, and
Yeah.
how autoimmune diseases are grows
Yeah.
like this. And maybe it's if it's helpful for us to find out much many diseases like and sure about like rheumatoid arthritis and all other diseases for this, and we are really don't know about what is how we treat these things, and maybe hope so in the future we will find out the
Eventually,
things.
yeah, yeah, yeah. They're working on a lot of AI models to find medicine that would, for example, it was recently discovered by mistake that a medication, I remember this because you just mentioned rheumatoid arthritis. Rheumatoid arthritis can be treated with this medicine called baricitinib. Because it ends in inib, you know that it's some kind of inhibitor, and it is. It's a tyrosine kinase inhibitor. Turns out they by mistake discovered that it actually fixes alopecia too. And that's so far fetched because what is the connection between rheumatoid arthritis and alopecia? Nothing really besides the fact that they're both autoimmune disorders. These kinds of discoveries keep happening all the time, and AI is really good at predicting that there might be such a scenario, which then causes brand new trials to come out to see, hey, ChatGPT thinks that, let's just say, for example, ChatGPT thinks baricitinib may actually fix blinding. Then you're going to get a lot of rheumatoid arthritis patients and a lot of non-rheumatoid arthritis patients, and they're all blind. And then you'll see if it helps fix the blinding. And it might be a discovery, it might not, but that's what trials are, and that's what gets you funding. So great question, and definitely some kind of curiosity I encourage all of you to have, because curiosity is what got us here, and it's what's going to take us further as well.
Yeah, that's the real things we need to research on these things, then we will grow up. Thank you so much, sir.
Yeah, no problem.
Is there anyone else who have any sort of query or any sort of question? No. Ma'am Almira, do you want to say a few words? It will be honor for us. I guess she's facing some sort of internet issues. All right. Before ending the webinar, I want everyone to please turn on your camera to take a picture.
Oh, nice.
So please, everyone. Miss Muskan, Miss Zishan, Zarish, Hibba, Tubsha, Moiz Anis, Afzal,
Don't be shy,
Miss
guys.
Fatma. Please, everyone, turn on your camera. Miss Arbish, Miss Alia Aruj, Miss Asma Butt, Bajwa Noor. All right. I'm going to take a picture within a couple of minutes. Just make sure that everyone turn on the camera who finds it suitable. I guess ma'am just want to speak something. Please turn on the mic and hear you.
Also, I wanted to thank our respected lecturer today. Really, you got very interesting information about ChatGPT. I think that especially for students of medical education, it's very important. You know about that students of medical education or medical students, they are so curiosity. Yeah, using ChatGPT, it's analyzing of something. It's really good. Yeah, and today we got more information about using ChatGPT in different kinds of spheres. Thank you so much.
Yeah, no problem. I'm glad I was able to do that.
I also want to tell you Thank you very much because, as I told you in our first meeting, it's so important for teachers and also for the students, and they listen about their own ears. What about you told, and maybe a little more understood. And it was the first our meeting with students. Maybe we have more, and step by step they will try to know more better about this application. As Gujaz ma'am told us, it is so important because it gives us possibility to take a lot of information in the so short time, and of course it helps us so much. And but of course we have plus and minus in this. But of course nowadays we think that plus is more than minus. That's why, of course, for scientists, for the medical specialists, it's so important because sometimes we need so fast to find some information, and when we will use AI, it will so much faster we can find, and of course, it will help us so much for analyzing all data, and we will not need to lose a lot of time for find information and analyzing them. And also, of course, in this field is so much help us. But of course, I know that our students want to know more, but not more about research, about not only about AI, but also in different other topics. And we hope that we will continue to work with you.
Also, I
Thank
want
you so much for your presentation.
Oh my God! In future, I want to arrange such kind of meeting if our respected lecturer will agree for our teaching staff, for faculty staff. Are they use GPT actively in their presentation, in their lecture, in their practical courses? It will be so good. Because our students are very interested in something, are interested in new information, but also our faculty, our respected teacher, also should use ChatGPT just in a very interesting way, or giving the task, or maybe some or a project learning, maybe project-based learning activities, or maybe problem-based learning activities, like making some situation between patients and doctors.
No, it was an absolute pleasure. I'm really grateful to all of you for allowing me to be here and talk to you guys. It's been very fun, and I will definitely, I'll do as much as I can. I'll definitely be back again. I look forward to seeing a lot of you guys, and thank you for the questions you guys had too. So yeah, it was a pleasure.
All right.
Of course, our PhD students use ChatGPT, but if they will listen your presentation, they will be more know about it.
Good.
All right. Let's take a picture on the count of 10.
Okay.
So those who didn't open the camera, you can if you are comfortable. If not, then it's perfectly fine. All right. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Once more. 3, 2, 1. Smile. Thank you so much for everyone to join this webinar. I'm so glad that you all took part of it. And thank you so much for Ma'am Guljaz and Ma'am Almira to join the webinar as part of our faculty member of ISM UK.
All right, perfect. Thank you all so much. Take care, everybody.
But all thanks to our speaker, because your presentation was great, and without you, we did nothing for this meeting. Thank you so much.
Thank you so much. And also, I do encourage, if anyone wants to reach out, if you have any questions or anything, feel free to ask Ubaid for my email or something, and we can all connect and we'll talk again. And hopefully, I'll be back soon and do another talk.
For sure, I will also share Mr. Amir mail ID on the WhatsApp group.
Perfect. Okay.
So you can ask me or feel free to ask him as you feel more comfortable.
Okay, sounds good. Bye,
Yeah, and
thanks so much.
everyone, and really good job, Ubed, that you have worked on this thing, and I really appreciate your efforts. And thank you so much, everyone.